Hi there, I'm Nikki Butler and I'm a skin and scar specialist. And in this video, I want to talk to you about chemical skin peels. Now, I am contacted about skin peels an awful lot, and it is something that I used to offer in my clinic. But I think something that I always find quite upsetting when I speak with clients are the promises that have been made with skin peels. So very often people will contact me and they have spent quite a lot of money on a course of peels for scarring, for example, or for chronic melasma. So melasma is a pigmentation disorder that almost looks like a rash of pigment on the skin. And it's really important to understand what chemical skin peels are and the results that you can achieve from them. And when I speak to clients that have got aging concerns, so I'm talking clients that are typically 40 years and older, where they've been recommended courses of peels, and yes, they have seen that their skin looks slightly brighter, but they've really not targeted those lines and wrinkles and the deeper sun damage. They feel really frustrated that they've spent the time and the money and not seen the results. So the thing to understand about skin peels is they're superficial. So essentially what they're doing is they are removing the dead layers of skin from the surface, which is going to give you a brighter, more glowing look to your skin. They're also great to help remove dead skin cells so that your other products can work really well. So absolutely they have their place. Think of them as a great treatment to have if you've got a big event coming up, or if you want to kind of have that glow and clear away those dead skin cells. They're pretty good after you've had a summer holiday and your skin is feeling kind of a little bit tight and dull and needs a bit of a boost, and through the winter. What skin peels will not do is they are not going to significantly boost collagen and target aging concerns. Yes, you might see an appearance improvement with fine lines and wrinkles. So they might kind of feel like your skin's more hydrated or smoother or more glowing, but they are not going to fundamentally change those lines and wrinkles. They may lighten some sun damage, but again, very, very slow process, and usually in combination with targeted skincare. So if you've got significant sun damage that isn't melasma, then IPL skin rejuvenation through the autumn and winter months, that's your golden ticket treatment. So that is like an airbrushing result of sun damage and pigmentation issues that is much more effective and much quicker than having a course of chemical skin peels. When it comes to things like scarring, they just don't cut it. And I always feel really heartbroken when my clients contact me and they've got acne scarring, or I've even seen people that have been treated with burns with a course of chemical skin peels and literally made no difference. And they won't. They are a superficial treatment. They are not going to stimulate collagen. They are not going to impact scar tissue. And yes, again, you might notice that your skin looks brighter because they're removing the dead skin cells, but they're not going to give you transformative results. And I think it's really important to understand, if you're thinking about chemical skin peels, what it is that you want to achieve when you're having the treatment. It's like any treatment. What is it that you want your end result to be? If you're looking for tighter, firmer skin, not skin peels. You need to be looking at things like radio frequency microneedling, HIFU, oil therapy, something that is fundamentally going to boost collagen within your skin. If you have significant pigmentation, I would suggest looking at something like IPL, because that's going to help address that much quicker, and using targeted skincare is going to inhibit the further overproduction of melanin. If you have melasma, which is it's often referred to as like a pregnancy mask, so it's pigmentation that is usually hormonally impacted, you can't have the big treatments like IPL because it can actually make it worse. So skin peels are a good option if you have melasma, alongside targeted skincare, and your sunscreen is absolutely essential. If you have deep lines and wrinkles, skin peels are not going to cut it. They're not going to work for you. Forget it. If you have fine lines and wrinkles, so if you're around your late 20s to kind of 30, you want to boost your skin and you have fine lines and wrinkles, you may see some improvement, but don't expect miracles because they're not producing fresh, healthy collagen. You need something like microneedling to do that. I think chemical skin peels are great if you've got an event to go to. Make sure you have a patch test with many of them. So something that I see quite a lot of are allergic reactions to chemical peels. Not all peels are going to need a patch test. If some of them are very low strength and there aren't really any risk of side effects, you might not have a patch test. But any of the bigger, more targeted peels, I would absolutely expect you to be having a patch test in advance to make sure you don't have an allergic reaction. Never have your peels straight before an event, because if you do get any flaking or peeling, you obviously don't want that for when you've got your big event. Always talk to your therapist about the reason you're having the peel, what result you expect to see, and how many treatments you're going to need. So for a big event, absolutely, you might just need to have one peel. But if you're treating something like melasma, you will likely need to have a course of treatment that could be 6 to 8 treatments that you would have 2 to 4 weeks apart. Again, those timescales will vary depending on what the peel is that you're having. So always speak with your practitioner about it. And they are something that you need to have regularly. Using them alongside targeted skincare is usually the way that you would go, because they're a superficial treatment that is essentially clearing the way for other products to work well. So if you've got targeted skincare that is lightening pigmentation and inhibiting further overproduction of pigmentation, that's where you're going to get your winning results. So I hope that helps. Like any treatment, I think every single treatment has its place, but it's really important to understand what the result is that you want to see, what you're targeting, and therefore which treatment is the right option for you. If you have any questions at all, please reach out to me on any of the socials. I'm going to pop a link to the blog that I've written on skin peels below the video, so please have a read of that. And if you have any comments or questions, please get in touch. Hope you have a great day.